A lot of students want to study public health at master's level. They have the passion, they have the motivation, and that's amazing because public health needs people who care. But before you rush in, there's something important that you need to know. Public health isn't about textbooks, lectures, assignments. It's about people, it's about communities, it's about systems. And that is the reason why, in as much a lot of people want to study public health at master's level, they don't even get into the programs. Why? Because experience matters more than many students realize. So the fact that you would have done maybe a social science degree or your humanities degree, or maybe you are into medicine, or maybe you have done something related to nutrition, doesn't only guarantee you that you get into the admission program at master's level for public health. You need to pay it with experience. And if you have been here long enough on this platform, you have seen me posting many scholarships about public health, and I am always advocating that don't just apply for the sake of applying and then put an addition to the numbers to the rejected programs that you have applied to simply because you want to apply. Experience is the backbone of that program. Many people without experience are not able to get into the public health master's degree because they don't have experience. So if you're obsessed with, doing an MSc in public health, the enthusiasm or the motivation to want to be doing public health is okay, but it's not enough. And also the passion that you have won't prepare you for the realities of the sector. You need real world exposure. Most of the people that get into this program, if I had the privilege to bring in people who have done that program, you would see one thing that's common among them: work experience, real life work experience. Their involvement into communities is what guaranteed them a place for a master's in public health. So their experiences are an integral part of the program because experiences can teach you things that no classroom can. And their curriculum mainly is designed in a way that whatever it is that they are doing in that program will be related to the different experiences that they have done. So you would see that they don't want to enroll a fresh graduate who has not have had any work experience, who has not worked into the communities, because when you're doing that master's, you have to relate the content that they are giving you with what is there back at home or what is there in your community. It is very important. Their curriculum is based on real life experiences. So when you have worked on the ground and you get a master's admission or a public health master's admission into the program, you understand the challenges better. There's this thing whereby when we do our degrees, when we do the content of our curriculums in our degrees, we assume that whatever it is that we are learning from the textbooks is applicable into the real world. Until we start working and understanding the real life scenarios, or we are in a situation where we are able to apply that knowledge, we will understand that textbook things are different from the practical things. Textbook things are there to guide you. Textbook things are there to show you the way. But when you get to the ground, you have to adapt. And this kind of program, Masters in Public Health, really needs people who have experienced the things that they are learning. It is important because once you are on the ground and you come to school and add, the textbook things that they are giving you, you have an open mind in a scenario whereby you are going to say, this is not possible. This doesn't work. We need to follow the rules A, B, C, D. When you are learning and you understand that communities are gifted at different levels, or when you understand that we have communities maybe that don't really have access to education or access to, clean water, and you have worked in those situations, the way you approach a situation becomes different from someone who just came from school and believes all the statistics that comes from their, from the news or from their a documentation that says we have reached 100%, clean water. Everyone has access to clean water. That way, when you're given that scenario, you will say, everyone has clean water. That's it. But if you have worked on the ground and realized that statistics might lie, they would say 100% clean water in all communities, but you visit a certain community and you see that that is not the case. Or maybe you are in a medicine profession and you work at a hospital and you believe all those things that you used to see on the internet, but when you're now in the hospital and you're working, you see real life scenarios, then you realize that at the hospital that you're working, those things were and those basic things are not even available. Those are the things that they want to enroll into the program. I only talked about one or two things that I could, but public health is open to a lot of disciplines. But they need people who have experience, who have professional experience in that field, because that master's is for real life scenarios. It's something that needs you to have experienced what happens in the real world. So your insight or your experience actually makes your master's degree richer, easier to understand, and far more impactful, because urkudzidza, you are learning things that you have encountered and you are learning how to make it better. But you see that that trend of just saying, I've just finished my bachelor's degree, I want to do master's in public health, has to pass you unless you have work experience, because that degree will test you, will actually test you. That fire. I would like to end with, if you're passionate about public health, keep that fire, but pair it with professional experience. Don't just rush from your bachelor's and say, I now want to do public health. Before you work, before you have professional experience, before you have exposure. And professional experience doesn't necessarily mean that you have to get a job, but working in the communities, the degree is so vast, it's so diverse. You can even volunteer 1 or 2 times a week. Whilst you're doing your profession and doing all of this, volunteer 1 or 2 times a week to get a real feel of what the real world is or what real scenarios are. You can volunteer. And sometimes you don't need to volunteer whilst you're on the ground. You can volunteer online. I've seen a lot of, things that you can volunteer online, and you're actually building your experience towards studying public health. If you're passionate, only passion doesn't take you anywhere. Pair it with professional experiences. Start doing things in your community. Start engaging with people who have walked the paths before you, who can mentor you into that, because public health is actually a backbone of our communities, and it needs people who really understand where they are coming from, where they are going, and what needs to be done to ensure that our communities are much more safer. So I would like to emphasize that passion is not only enough. Pay it with experience. Don't just chase the degree. Say, I want to be someone who has done masters in public health. Build the foundation. Take time to build the foundation and let it thrive once you get it. So foundation is very important. Your passion is the spark. Your experience is the fuel. Together, then you are unstoppable in public health. Don't just hop on the trend. I want to do public health. I want to do public health without real life experience. Please make sure to invest in having experience in that field. I hope this helps you and probably gives you a clear understanding of why maybe you applied for public health last year and you didn't get it, and you were like, I have a first class degree, or you were asking yourself, I just finished my degree, why is it I could not get it? You were questioning a lot of things. Public health is a different ballgame altogether, because experience is an integral part of their admission process. So do not beat yourself about being rejected for the program, but instead, as we start 2026, build that experience, volunteer, do some internships, and build the CV around the postgraduate experience that you want to have. Thank you guys for watching. Don't forget to like, subscribe, share with your loved ones who will benefit from this video, will benefit from knowing what exactly public health wants. Bye. See you in the next one.